Doctors searched for cheaper and simpler ways of administering AZT to pregnant women.
The American study was done about 6 years ago, and this was followed by the Thailand study, which was a study designed to look at a cheaper and an easier way to administer AZT. And in this study, AZT was given for the last 4 weeks of pregnancy to the mother, then also during labor, and the babies were not breastfed, but the babies weren't given AZT in this study. And they found in this study that the transmission rate was reduced by 50%.
The cost of the medicine needed per woman to achieve the Thai results amounts to only 400 rand. More recently, studies similar to the Thai one have been done in Tanzania, Uganda, and South Africa. Here, researchers gave women AZT together with another drug called 3TC. Although the woman in this study breastfed, the mother-to-child transmission was still reduced by about 50%.
Ingane yami ikhona nje yena kodwa isilokhu badokubetest na 3 months athola ukuthi negative bebaphinda futhi na 9 months bathola ukuthi iselokhu negative baphinda futhi sinonyaka this year bathola ukuthi iselokhu negative.
We have had a research unit at Chris Hani Baragwanath, and we've been involved in a very large trial giving AZT and 3TC to pregnant women to look at the effect of that on transmission. We now have a limited access program with some drug that has been supplied by UNAIDS, and we are negotiating for a larger pilot project. Because what is very obvious is that it doesn't matter if we were to fly drug in here tomorrow. We need to have a lot of other things in place, like testing and counseling, like proper supply systems, in order to take this wider. And we would now like to move into that step with a large pilot project that would provide drug for about 5,000 women.
So far, government has refused to pay for AZT for pregnant women because it says it cannot afford it. Researchers are now looking at giving less AZT to women, and it looks as if this shorter course of AZT can still bring down mother-to-child transmission to about 37%. The cost of this treatment will be even less than 400 rand.
I do not know how much the drugs cost if I had to pay for them. But then, even if I knew, I would not have money to pay for them.
In the meantime, a study done in Uganda, which compared AZT with a drug called nevirapine, showed promising results. While AZT cost 400 rand, the amount of nevirapine used per woman in the Uganda trials costs only 40 rand.
The Uganda study found that the mothers who were given nevirapine, they in actual fact had a much lower transmission rate than the mothers who were given AZT. It was of the order of about 12% compared to 22% in the mothers who got AZT. So it was again quite a dramatic effect. I think the advantage of the nevirapine is that it's a single dose.
A similar trial comparing the effectiveness of AZT given together with 3TC with nevirapine is currently underway in South Africa.
Our trial started in March 1999 and should be running for 10 months after that.
But Dr. Dwamini warns that it is vital to run well-controlled trials before dispensing drugs to people.
It would be very, very irresponsible of the medical profession to use any drugs that are not specifically tested and haven't been proven to work.
Bernice's health has improved considerably since she has been enrolled on a drug trial at the beginning of this year.
The observations since she's been on the drugs, the observations I'm seeing is that she's hardly falling ill. She's not getting any fevers like temperatures, high temperatures. She hardly gets diarrhea. She is very hyperactive.
At 1,000 rand a month, Elizabeth would not be able to pay for her daughter's medicine herself. However, if AZT would have been available when Elizabeth was pregnant, Bernice would not have been ill in the first place. The government is aware of the studies undertaken with AZT.
I suspect that the real bottom line is cost, and that the health services in all provinces are under a lot of strain, and this is perhaps just not seen as a priority. And I think it's that perception that we have to challenge. 1 child out of every 10 born today is going to die of HIV. Now, why is this not an emergency? If a cholera epidemic came sweeping through the townships around Durban and started killing off one person in 10, there would be all sorts of resources mobilized to stop it. But somehow, for HIV, we don't have that sense of emergency. There's almost a fatalism attached to it that says it'll happen anyway, there's nothing we can do.
AZT and nevirapine will prevent the majority of babies from being infected with the HIV virus. Research shows that it is cheaper to prevent HIV in babies than treating the disease. Will the government implement this program? Will the drug companies lower their profits to make AIDS drugs like AZT and nevirapine affordable? These questions remain to be answered.